Good morning. So I'll just start with our regular briefing and then I'll turn it over to Marion. There are 2 new cases of COVID-19 to report today. One case is a female under the age of 19 who is a close contact of a case announced last week. She remains in self-isolation and was diagnosed on routine testing. The second case is a male less than 19 years of age, and the case is just under investigation, but it may be related to regional travel. In the past week, we have reported 8 new cases of COVID-19. On Friday, we reported 4 new cases. One was a male who traveled outside Atlantic Canada and tested positive on routine testing, and 3 were linked. One, a male in his 30s who also recently traveled outside of Atlantic Canada, and 2 of his close contacts, a female in her 30s and a male under the age of 19. The adult male initially tested negative, and upon developing mild symptoms, he tested positive. Yesterday, there were 2 cases announced by press release, a male in his 20s who recently traveled outside of Atlantic Canada, and a female under the age of 19 who is a close contact of the cases announced last week. Again, her initial test was negative, and upon routine testing, she tested positive. So in total, there are 5 cases that are linked together since Friday. We are confident that these cases were detected early and there's no evidence of widespread community transmission. Had these cases gone undetected for even another day or 2, we would be dealing, I think, with a very different situation, as the virus would have had more opportunity to spread. As I've noted before, COVID-19 moves when we move. This situation highlights the importance of being tested even with mild symptoms. It also underscores that testing negative on one day does not predict that you will be negative the next day. A negative test confirms you are negative for COVID-19 at that point in time only. As a result of these cases from the weekend, 54 people were identified as close contacts and are now in self-isolation. It is a legal requirement for close contacts of a positive case of COVID-19 to quarantine for 14 days after their last contact with a positive case. And they also are required to be tested. We know it is challenging for close contacts to self-isolate. It is disruptive to families. Some people lose income, and children cannot go to school or participate in sports and other activities. We know it can be difficult to keep people's spirits up when in self-isolation, and it takes a toll on everyone involved. This particular situation is unique because 72% of the close contacts are children, meaning that in almost all cases, a parent is required to self-isolate with their child. So in reality, there are many more than 54 individuals in isolation. I want to thank the many children and families who are in self-isolation. Thank you for doing your part to protect yourself and others in our community. Some have asked questions about close contacts and timing of their contact with a positive case. When an individual is diagnosed with COVID-19, public health determines close contacts based on the information we have, and will do so within 48 hours prior to their positive test or the onset of symptoms. It is likely that people with COVID-19 were infectious or could transmit the virus in the 48-hour period before the onset of symptoms or testing positive. But if you have a negative test, we don't need to go back prior to that. We currently have 8 active cases and a total of 152 cases since the pandemic began. In Canada, there have been over 938,000 cases and 22,700 deaths since the pandemic began. Cases are up 11% in the country this week, which is concerning. These numbers tell us about the overall burden of COVID-19 illness to date. We know the vast majority of Islanders and Canadians remain susceptible to COVID-19. In Canada, although COVID-19 activity has leveled off since mid-February, and the average daily case counts though now are on the rise again. During the last 24 hours in Canada, 3,781 new cases have been reported. Infection rates across the country are highest among those aged 20 to 39. While severe illness is less common among young adults, it is important to remember that serious illness can occur at any age. In addition, transmission of among younger and socially connected adults is an ongoing risk for spread into high-risk groups. The increasing incidence of variants of concern is also worrisome. There have been over 5,200 variants of concern reported in Canada, the vast majority being the B.1.1.7 strain first identified in the United Kingdom. Other provinces are observing increased rates of hospitalization and deaths associated with the variants of concern. Some provinces, including Ontario, have entered the third wave of this pandemic and are advising people to be cautious and vigilant in order to minimize transmission of the virus. Maintaining public health measures and individual precautions remains critical to prevent a re-acceleration of the epidemic. We will maintain these measures until enough islanders are vaccinated to achieve some herd protection. As of Saturday, 18,632 doses of vaccine were administered to islanders, including 5,622 second doses. I think we can be very proud of the vaccine rollout to date. We are administering vaccine to islanders as we receive doses in the province, and we are targeting vaccine to certain groups, as identified by the National Advisory Committee on Immunization. And our goal is really to continue to protect the most vulnerable, who are most susceptible to severe outcomes like hospitalization or death. But it's also to try to vaccinate those who are at risk of having or living in places where, or working in places where there can be severe outbreaks that have terrible impacts on our society and our ability to function. Of the 13,010 people who have received at least one dose of the vaccine, almost 5,000 or 38% of them are over the age of 80. And certainly looking at the numbers and speaking with Marion this morning, around 80% of islanders over the age of 80 have received at least one dose of the COVID-19 vaccine. This week, individuals over the age of 70 are making appointments to be vaccinated. And beginning on Thursday, people who are aged 60 to 69 with underlying medical conditions and their primary caregivers can begin booking their appointments. And this would include people who have organ transplants, specific types of cancers, cystic fibrosis, COPD, people who are on immunosuppressive medications, dialysis, individuals with developmental disabilities, including Down syndrome. I know more information will be available next week for those who are aged 65 to 69 who will be able to schedule appointments as well. And Marion will provide more information on the details around booking of the appointments. Just over half of the 2,000 doses of AstraZeneca vaccine received in the province have been administered to young people aged 18 to 29 through our 6 partner pharmacies across PEI. This vaccine is available to individuals who work in the food and beverage sector, including delivery, convenience stores, gas stations, and grocery stores. I ask employers and business owners in these areas to encourage their staff age 18 to 29 to be immunized, and if possible, please offer to assist with transportation and eliminating any other barriers that may be preventing staff from being vaccinated. And also starting today, with anticipated further doses of AstraZeneca arriving in the province in the next weeks, we'd like to suggest that those 18 to 29 who are not able to work virtually and work where they're interacting with the public also book appointments to be vaccinated. Health Canada issued a strong statement last week confirming the benefits of the AstraZeneca vaccine in protecting Canadians from COVID-19. And the statement indicates the benefits of the vaccine continue to outweigh the risk, and reiterates that any of the COVID-19 vaccines authorized in Canada are safe. In Canada, there is a rigorous and effective weekly reporting system to monitor and track any adverse effects related to vaccine. And we've said this before, but the best vaccine for each of us is the first one that is offered. Thank you to the thousands of Islanders who've already come forward to be immunized against COVID-19. And every person who is vaccinated helps the entire population. Last week, the Atlantic premiers announced their plan to reopen the Atlantic bubble by April 19th, provided the COVID-19 case counts remain low in the region and outbreaks are contained. Reestablishing the ability to travel within Atlantic Canada without having to self-isolate is very exciting and an exciting prospect for many, and it was anticipated and a welcome announcement for many Islanders. Between now and the reopening of the Atlantic bubble, we will continue to assess a number of factors, including the number of cases per day and the 7-day average, the number of non-EpiLink cases, the percentage of variant cases and variant outbreaks, and the geographic spread of cases, as well as the proportion of vulnerable populations that are immunized. It is my hope that when the Atlantic bubble is reestablished, that it will remain open indefinitely. I have been asked what will summer 2021 be like in PEI, and this is a challenging question because there are many unknowns, including the vaccine rollout and the potential impact of variants of concern. So it is difficult to predict with any certainty 3 or 4 months out when we are in the midst of a global pandemic. But consistent with our approach during the past year, we will take a slow, steady, and measured approach to easing restrictions. Summer 2021 will likely have some similarities, yet some differences to last year. We will not be hosting large mass events, indoors or outdoors, in 2021, but we do expect the gathering numbers to increase. Most visitors and tourists to our province will be from Atlantic Canada. We will likely see more visitors from outside of Atlantic Canada than we saw in 2020 as they apply in streams of travel, as they did last year, and had pre-approval travel. And as a result, I anticipate we'll have more seasonal residents and family members who will be coming back to PEI in similar or increased numbers. We will be continuing to administer the very important second doses of vaccine to all eligible 16 years of age and older, and I would anticipate also by the summer doing children aged 12 to 15 if the vaccine is approved for that age group in Canada. And I think we will likely see a return to more normal travel by the fall of 2021. As the COVID-19 pandemic enters its second year, I also remind Islanders to be vigilant about their overall health. In particular, individuals should seek and continue to receive care for chronic diseases such as cancer, cardiovascular disease, diabetes, COPD, and mental health conditions. Canada's provincial cancer agencies recently reported patient hesitancy to attend screening appointments and to visit an emergency department, a clinic, or doctor's office when cancer symptoms appear. Please attend all screening appointments. And if you feel sick or have any symptoms impacting your health, visit your healthcare provider. And I know these are messages that Marion has been mentioning at various times during the last year. Your health matters, and PEI's healthcare providers and the healthcare system are here for you. In terms of protecting ourselves and our family and friends from COVID-19, the very best steps we can take continue to be what we've been talking about for months: limiting the number of interactions we have with the fewest number of people for a shorter period of time, with the distance, the greatest distance possible, and wearing a mask. And if you have any symptoms of COVID-19, even mild ones, please be tested. And someone said to me earlier today, our tunnel that we're going through in this pandemic has not been as dark as many others across the country or around the world. We have been fortunate, and we've really worked hard and made many sacrifices as a province and as a community. But we are all very much looking forward to the light at the end of the tunnel. So as we continue this journey with COVID-19, let us be patient and let us be kind. Thank you.
Good morning, everyone. It's a beautiful spring day outside, and I hope the sunshine and warm weather these past couple of days is helping people remain resilient during this pandemic as we continue to vaccinate more and more Islanders each day. I have a lot of details today in my update to provide you, and they will be available on the website after, but I'll try and speak clearly today for people. So as Dr. Morrison mentioned, and we noted last week, starting yesterday, people aged 70 to 74 years old are now able to book their appointments for vaccination beginning yesterday based on their birth month. So yesterday and continuing today, individuals born in the months of January to April are able to book. Starting tomorrow, Wednesday, March 24th, individuals born in the months of May and August who are age 70 and above can book. And beginning Friday, March 26th, individuals born in the months of September through December are able to book their appointments. We also will be beginning on Thursday this week, March 25th, to have available booking for those individuals aged 60 and older with the specific underlying medical conditions which are outlined on the website. And those are the ones Dr. Morrison mentioned, some of them who are at risk for severe outcomes of COVID-19. Those individuals age 60 and older can book on Thursday, either by phone or online, and if those individuals have a primary caregiver, they may also book at the same time. Next week, we will start on Monday, March 29th, for individuals age 65 to 69 being able to book their vaccine appointments. This group is larger, so we are breaking it down into 4 groups based on birth month. So starting on Monday, the 29th, individuals aged 65 to 69 born in the months of January through March will be able to begin booking. Starting Tuesday, March 30th, individuals aged 65 and above born in the months of April through June will be booking. And starting Wednesday, March 31st, individuals aged 65 to 69 will be able to book through the months born in July through September. And on Thursday, April 1st, individuals born in the months of October through December will begin booking. So you may start to see a trend in our booking system and how we're able to move through the age cohorts and look at the future rollouts of our vaccine available appointments. We'll be continuing through that age categories in the 5-year increments, starting most of them at the beginning of the week. So next week, it will be those age 65 and above starting to book. Only individuals identified during the current stage of booking are able to book online or to call to make an appointment for their immunization. Updates on other groups will be shared as we go along in the coming weeks. I do want to reassure people that there are many appointments available, and please try the online booking option if you're able to do so, as it works very well and takes only a few minutes and is available 24/7. Appointments can be booked online at the princeedwardisland.ca/getthevaccine website or by calling the phone number, which is 1-844-975-3303. If you use the phone line and don't get through at first, please be patient. You will be able to book your appointment, and everyone in the age category who wants to be vaccinated will receive an appointment in our scheduled clinics. This week, the phone line hours are from Monday to Friday from 8 a.m. until 8 p.m., and we know that they're busiest in the early morning hours, so if you do start throughout the day, then the line should be open to you. This Saturday, it will be staffed from 8 a.m. to 4 p.m., and the phone line is closed on Sundays. The online booking option, as I mentioned, is available 24 hours a day. And as a reminder as well, you do not require a PEI health card to book a vaccine appointment. Additionally, I just want to note that the primary partners in care for individuals living in long-term care and community care have started to receive automated appointments through our electronic booking system. These are being made to ensure the partners in care who provide important support to those individuals receive the vaccine as well. It is exciting to see the increased amounts of vaccine arriving on PEI, and our booked appointments have been scheduled to provide these vaccination doses in these larger amounts. We're planning for the start of our large clinics beginning on Monday, March 29th, and only the location for the Charlottetown and Summerside clinics will change on this date. The Summerside clinic will be moving to the Holland College building on Water Street in Summerside, and the Charlottetown clinic will move to the Eastlink Center on the convention side. Your appointment dates and times stay the same, and you do not need to do anything about your appointments that have been booked. Your appointment reminders, which will be sent to you, will indicate the new location. There's no change in location for the O'Leary, Montague, or Surrey clinics. And when booking your appointment, you can look at the location which best suits your schedule, as there is availability in multiple locations. The patients booked for clinics on Good Friday are being rescheduled to the next day, Saturday, April 3rd. And your appointment reminder will indicate this new date to you. As well, some second dose appointments that were originally booked in March are being moved to align with the new guidelines of spacing between doses. Those individuals will receive an automated appointment for a new date and time through our online booking system. I want to thank everyone who continues to follow our direction, and in particular thank those who continue to come forward to be tested when you have any symptoms of COVID-19. As Dr. Morrison mentioned, it makes a big difference to the impact in the community, even though we know it is hugely impactful to those individuals. I hope that everyone enjoys the day as best you can, and we look forward to more good days ahead as we continue through this rollout. Thank you.
Great. Thank you, Marion. There may have been some technical, by what was happening around us, I think there may have been some technical issues with the sound, but I think those are being worked on. So as that's happening, I'll open it up for questions from the media.
Gabrielle Dumont, Radio-Canada.
Good afternoon to you both. Ma question, c'est en français, comme d'habitude, Dr. Morrison. Alors, je voulais revenir à ce que vous avez parlé concernant les cas qui ont été signalés. D'abord, ils ont reçu un test négatif pour la COVID-19, puis ils ont passé un deuxième test, et cette fois-ci, leur résultat a été positif pour la COVID-19. Alors, on commence à voir que ça arrive de plus en plus souvent. Maintenant, ici à Lille, c'est plus qu'avant. Alors, je sais que vous avez expliqué ça en anglais, mais pourquoi ça arrive plus souvent maintenant ici à Lille?
Bonjour, Gabrielle. Je ne pense pas que ça arrive plus souvent, mais je pense qu'on commence à en parler plus souvent parce que c'est pour que les personnes vraiment comprennent que l'importance de rester isolé, même après un premier test qui est négatif. Parce qu'on avait des fois des personnes qui, après un test négatif, ils voulaient quand même sortir, ils ne voulaient pas isoler. Et puis, alors, c'est quand même qu'on annonce que ça peut arriver, même après un test négatif qui devient positif après ça. C'est important que tout le monde comprenne ça. Et c'est aussi qu'on identifie quelqu'un qui a un contact qui est proche. Si des fois, même après un test négatif, c'est parce que le contact était seulement hier. Et puis, on sait que ça prend des fois quelques jours avant d'avoir des symptômes ou de tester positif. Alors, c'est parce qu'on fait, je pense, assez bon job à identifier les personnes qui sont les contacts et de faire tester. Mais c'est tellement important de rester isolé et de faire d'autres tests.
Mm-hmm. Parfait. Et vous avez mentionné tout à l'heure là que oui, la bulle atlantique, on avait annoncé la semaine dernière que ça va rouvrir le 19 avril, ça s'en vient. Vous allez encore analyser les données épidémiologiques d'ici là. Mais Dr Morrison, quand est-ce que ce serait réaliste de penser à une ouverture de frontières de l'île au reste du Canada? Je sais que vous avez aussi mentionné, vous avez parlé de ça tout à l'heure en anglais. Quand vous discutez avec les autres autorités sanitaires des autres provinces, est-ce que vous discutez de cette possibilité réellement pour cette année 2021?
Alors oui, on discute avec mes collègues mais comme moi, je sais que c'est difficile de regarder trop en avance, de regarder en juillet ou quand on sait qu'il y a bien des choses qui peuvent arriver pendant cette pandémie. Alors, on veut commencer avec la boule atlantique et on veut qu'on peut garder cette boule. On a tellement, dans la région atlantique, on a moins de cas par 100 000 personnes que l'autre partie, l'autre part du Canada. Et on veut garder ça si on peut. Et on commence à discuter qu'est-ce qu'on peut faire quand on a plus de personnes qui sont vaccinées. On veut protéger les insulaires ici et la région, mais on sait qu'il y a les personnes d'autres parties qui veulent venir ici. Mais comme l'année passée, on anticipe avoir les personnes qui sont familles peuvent faire l'application pour arriver à l'île du Prince-Édouard. S'ils sont les résidents saisonniers, ils peuvent aussi faire une application. Alors, mais on discute et puis ça va dépendre ce qui arrive ailleurs au Canada et qu'est-ce qui arrive avec les variants. On regarde même au pays en Allemagne, en France, en Grande-Bretagne, partout, qu'est-ce qui arrive aussi avec COVID-19.
OK, parfait. Merci beaucoup. Bonne
Merci.
journée.
Bonne journée.
Brian Higgins, CBC.
Yes. Hi, Dr. Morrison. Yeah, you mentioned that more than 70% of the close contacts of the weekend matters are children. Can you expand on that and just tell us how surprising that is and a bit more about the demographics of those young people?
Well, hi, Brian. Good morning. And so we looked at, I think in this case, I don't think it's surprising that we have a number of close contacts identified. We identified that I guess now 3 of the cases that are all linked together are less than 19 years of age. So it would make sense that some of the close contacts are also less than 19 years of age. So I think I think there were 38 of the 54 or 39 of the 54 close contacts are in that less than 19 years of age group.
Okay, thank you. And a follow-up question about mass vaccination clinics. How will that change the rate at which we get the vaccines into the arms of islanders?
Well, maybe I'll start and then Mary can add. I mean, I think it's just a good chance, Brian, to clarify what we mean by mass clinics. And I think really we are going through, as you've heard, us outline details of groups of people that are able to start booking their appointments. The clinic sites, or what we called mass clinics, really are just locations where we can have more appointments during the day and do so in a safe way, so we can have more appointments and put through more people who are in those particular age categories, for instance. So they're the same types of clinics that we already are running, except that they're going to be in certain situations in bigger locations. And so I think, but absolutely the goal between now and the end of June, because we are anticipating more vaccine coming, we are more confident in the vaccine coming, that we do want to vaccinate more people and do so as quickly as we can. So that's why these bigger sites are being established so that we can vaccinate more people.
Yeah, I think just really it is about the sites are still our booked appointments, and we've been basing that on our vaccine shipments. So all along, really, our goal is as the vaccine arrives, we get it out to people in those priority groups as quickly as we can from the date it arrives and is available to us. So the larger clinics will still be our booked appointments, but as I mentioned, although I'm not sure if my mic was working and people could hear me, but as the increased vaccine shipments arrive, we have added appointments based on that arrival of those vaccines. So we will just be ramping up our clinics to meet the shipments that are coming to us and get it out to Islanders as quickly as we can.
Thank you.
You're welcome.
Louise Martin, CBC.
Hi, good afternoon to both of you. My first question is for Dr. Morrison, and it's regarding seasonal residents and what the process will be like and when that process will begin for them to begin to apply to come here, and how that will work with vaccination, whether you're from within Canada or perhaps even from the United States and wanting to come to your seasonal property on PEI this summer.
Hi, Louise. So I guess a couple parts of that question. Right now there are streams of travel for people to apply to come here, and that includes seasonal residents, family, work, compassionate. Those are all part, and that can happen really at any time. And at this point in time, if you arrive today, whether you have received vaccine or not, you would still be required to isolate for 14 days, basically for any of those categories. In terms of the seasonal residents who may be arriving from U.S. or internationally, those the U.S.-Canadian border, that is not that is a decision that is definitely with the federal government. And but if they open the border, then our same requirements for any one traveling to PEI would apply here. In terms of some of the other questions you have with regards to those who are vaccinated and how do the public health measures change, I will be here in the beginning of April outlining what we would anticipate might be some of the public health measures adjustments based on if you're vaccinated or not with regards to travel, both for Islanders who are traveling, but also for those who are coming to PEI. So we anticipate having more details on that in early April.
Okay, thanks so much. I'm also just wondering about the number of vaccines that we have on PEI right now. I know that you had said they're going to ramp up again in April. How many doses are actually on the island right now compared to how many are getting into arms? Is there a surplus of vaccines waiting to get into arms right now?
No. So we actually, I think, actually this was reported to me that PEI has one of the highest rates of actually the vaccine arriving and getting into people's arms in terms of the percentage. Now that may change, but certainly that was reported to me last week. So I think that's very good news. It means that we are, and they were asking me why that was the case. And I think our geography has helped. Very efficient health PI teamwork, getting these clinics up and running, and all, of course, Islanders who are wanting to be vaccinated. So really, we are doing well from that point of view. And as vaccine is coming in, we really are making sure that it's getting into people's arms, and that's down to every last dose that we open. If there's a vial open, we know we want to use every dose and not waste any.
Thank you so much. I appreciate that.
You're welcome.
Dave Stewart, The Guardian.
Good afternoon. I guess my first question would be directed at Dr. Heather Morrison, and I guess it would be, why was there, in connection with the cases since Friday, the press release late Friday afternoon, and yesterday with the 6 cases, I think there's some people wondering why there was no, I guess, briefing on the weekend, or at least a list of potential exposure sites. We have had some chats with some concerned parents. So any thoughts on that?
Hi, Dave. Well, you can rest assured the team was working all weekend. But usually we'll give information out if we know we can't contact people. So on Friday, late in the day, there was one exposure site. There have been 7 sort of workplaces or sites where we have been able to contact the individuals directly, or public health made those calls. So it was, it's not, and there's a risk assessment done on all these situations when people became positive, and were they in isolation before that happened. The 2 cases we spoke about yesterday had been in isolation since their first negative test. So they didn't have any exposure sites yesterday to report, because they've been in isolation since their previous test. So there was no additional risk to the public. They were all, of course, either related to travel outside the region or linked to the previous cases. So as you know, we go out often. We know that we want to get information out to people. We've been also communicating individually with a great number of people and their families, and all the close contacts of the cases on Friday were called before people went home on Friday night, and they were also called again on Saturday. So there were no additional exposure sites that we needed to get out to the public. For instance, a grocery store, because we aren't able to identify everyone who was at a grocery store.
Terrific. Thank you very much. And I guess my follow-up question, perhaps directed at Marion Dowling, with the, we seem to be on a great track in terms of vaccinations, and with plans being laid out for the Atlantic bubble and for perhaps a wee bit of a different summer. Do we know, sort of have a time frame in terms of when all islanders would have at least been offered the vaccine, late summer, early fall?
So
I'd probably let Dr. Morrison respond to that.
Oh,
We'll
sorry.
follow that protocol, but yes, I think we are on a good track, Dave. I would agree with that. But I'll let Dr. Morrison comment on the timing for the all islanders being offered.
Great, thank you.
Thanks.
Hi, Dave. So I think we had initially talked about wanting to make sure that 80% of eligible islanders 16 years of age and older would have a chance to have 1 dose of their vaccine by the end of June. I actually think, based on the vaccine numbers and how well things are going, that it will likely be before the end of June. And as soon as that happens, we'll be able to start rolling into second doses even before the end of June for everyone. So it would be my expectation that, based on what we know today, that by September we would be able to have 2 doses for certainly everyone who is 16 years of age and older. And in addition to that, if we'll be able to offer a vaccine to those 12 to 15 years of age, assuming approval by Health Canada as well, for at least 1 of those doses in the summertime.
Thank you both.
You're welcome.
Thank you.
I think that's it. So thank you all. Thank you very much. Enjoy this beautiful day.
Thank you.
Thank you.